Before the weight gain, before the labs, before the diagnosis, the mouth whispers what the blood eventually is screaming. So if you ask most dentists what caused gum disease, you'll hear things like bacteria, plaque, poor hygiene. But if you ask a doctor about fatigue, brain fog, or weight gain, you'll hear maybe it's your metabolism. But here's the truth. These aren't separate systems. Your mouth is part of your body, believe it or not. And often it's the very first place that shows signs of metabolic dysfunction. So before the weight gain, before the labs, before the diagnosis, the mouth whispers what the blood eventually is screaming. So welcome everybody to episode 72 of the Obesity Project, the hidden oral signs behind metabolic syndrome. My name is Dr. Mark Shankman. I'm an oral and maxillofacial surgeon that believed in treating the whole person, not just the patient's mouth. So I want to share this with you because it's so vitally important. Most people are not thinking about these things. So we want to first talk about how bleeding gums is the first sign of early inflammation. So bleeding gums aren't just caused by plaque. They're a sign of an exaggerated inflammatory response. So when you're insulin resistant, several things happen. One, your capillaries in the gums become much more fragile, causing bleeding and bleeding gums. Your immune system cells overreact to the plaque bacteria, creating greater inflammation. And collagen turnover slows, which is the first process in the periodontal situation. So there was a study in the 2020, it was a meta-analysis in diabetology and metabolic syndrome, which confirmed that patients with prediabetes had a significantly higher prevalence of gingivitis and early periodontitis than metabolically healthy peers. What this means in English is metabolic syndrome or prediabetes, type 2 diabetes, insulin resistance, all cause the early stages of gum disease, which is gingivitis, just bleeding gums, and early periodontitis, which is a breakdown of the attachment of the gums to the teeth. And that's what eventually causes bone loss and loose and mobile teeth that fall out. So people with metabolic syndrome have more of a prevalence of these early symptoms and the later symptoms as well. So let's talk about a real world example. There was a patient I know who brushed daily, but still bled every single time they flossed. And no, they didn't need a new toothbrush. What they needed was a new metabolic baseline. So one of the lesser known symptoms of metabolic syndrome is xerostomia, otherwise known as dry mouth. And I always like to say to my patients that, you have to justify 12 years of school, post-high school. So by giving all of these things, big fancy names, that's the justification. So why is it that metabolic syndrome causes or creates a situation where xerostomia or dry mouth starts? Well, it's because insulin resistance disrupts the autonomic nervous system. That's your sympathetic nervous system, which is your fight or flight, and your parasympathetic nervous system, which is your sort of rest and digest. So this also includes salivary signaling. So many people with insulin resistance are on medications like antihypertensives or blood pressure meds, antidepressants or diuretics, which cause you to pee out excess fluid. All of these things, all of these medications can all cause dry mouth. And there was a 2018 study in the Journal of Oral Science that found that salivary flow rate was significantly lower in insulin-resistant patients. They had less saliva, independent of age or medication. So just the fact that you have metabolic syndrome, irregardless of any of the medications you're taking, will cause this dry mouth situation. So let's use an analogy. Saliva is your mouth's built-in detox and buffering system. If you lose it, you lose pH protection, remineralization, and bacterial clearance, which basically leads to cavities and gum disease. So let's talk about another diagnosis that's not talked about very much, known as smooth tongue and burning mouth. And this is caused by nutrient malabsorption. So, have you ever seen a tongue that looks red, glassy, and really, really sore? That's often a sign of a vitamin deficiency, especially B12, iron, or folate. Now, these deficiencies are much more common in, you guessed it, insulin resistant individuals. Also, people with poor gut function and those eating a high carbohydrate, nutrient poor diet. So, research from BMJ Open in 2017 showed that micronutrient absorption is significantly impaired or decreased in individuals with metabolic syndrome, especially certain micronutrients like folate and B vitamins due to altered gut flora. So, the bacteria in your gut do absolutely influence your absorption of these micronutrients. So, a practical tip for you, if you have a persistent tongue discomfort or burning mouth, which is extremely difficult to diagnose and to identify the source for, and your labs, they're looking normal, then you want to dig deeper into metabolic causes and gut integrity. And I'm certainly focusing on this more and more in my own practice. So, item number four that insulin resistance can affect as well is receding gums and bone loss. So, gum recession isn't just about brushing too hard, which is what most people actually feel like is the cause. And that's not actually true. It's caused by the periodontal attachment or the gum tissue attachment to the teeth and the bone that starts to break down. And as that starts to break down, the bone level drops, and suddenly you're getting root surfaces exposed due to gum recession. Well, that's a dental cause, but it's also all about chronic systemic breakdown. You get things like elevated C-reactive protein, TNF alpha, and interleukin 6, which are both inflammatory mediators. And all of these items, the CRP, the TNF alpha, and IL-6, interleukin 6, all are seen in insulin resistance. And what this does, or what these mediators do, is they accelerate the periodontal ligament breakdown and alveolar bone loss. So, what this means in English is the gum tissue attachment around the tooth. There's a periodontal ligament around the tooth. It's sort of, I always say, it's sort of like a shock absorber. So when there's forces placed on the tooth, there's this ligament that can kind of flex and move with the tooth as opposed to just jamming the bone and causing damage. So you get an accelerated breakdown of this periodontal ligament and the bone around the teeth, which is called alveolar bone. You get breakdown of that bone from the attachment of the gum tissue to the tooth and the bone being broken or damaged as well. So there was a study in the Journal of Periodontology in 2011, which found a very strong correlation between visceral adiposity or central fat storage and periodontal bone loss. Surprise, surprise. Independent of age or smoking status. And this was a study by Saito et al. So the clinical takeaway from this is when you lose jawbone, you're not just losing teeth, you're losing stability in your metabolic scaffolding. So item number five that gets affected by insulin resistance is halitosis, which is otherwise known as bad breath. And this is basically fermentation gone wrong. So chronic bad breath isn't just embarrassing. It's often a sign of microbial imbalance or the balance of the different bacteria in your mouth and in your gum lines. And certain bacteria are more bad breath causing, others are not. So you get an imbalance of those good versus bad sort of bacteria, similar to the way the gut microbiome works. And in insulin resistance, carb-heavy diets fuel things like overgrowth of fermenting bacteria, which cause that bad breath, ketone dysregulation in type 2 diabetes, which is an important source of energy, and sulfur-producing anaerobes, which also contribute to a really bad, foul smell to the breath. And in a 2020 study in Scientific Reports, they found a distinct oral microbiome signature in patients with metabolic syndrome, including elevated levels of certain bacteria known to contribute to bad breath or halitosis, such as Fusobacterium nucleatum. And this is a known halitosis contributor and inflammation trigger. So if you get an increased amount of these specific bacteria, the Fusobacterium nucleatum, then that will trigger you to have bad breath and increased inflammation. So the way to think about this, and I talk about this when it comes to sleep apnea as well, think about bad breath as smoke and the systemic dysfunction as the fire. So the bad breath is a sign or a symptom or the alarm that there's systemic dysfunction going on at deeper levels. I use this all the time when I talk about sleep apnea, that the snoring of sleep apnea is actually the alarm. The problem is when you go silent, you're actually not breathing, and that makes it worse. And so you don't want to just silence the alarm. That's why you don't want to just use like snore guards and nose strips and all these other things if you have sleep apnea, because you're basically pulling the batteries out of the alarm system, and the underlying problem continues to burn. Similar to what we're seeing here, where the bad breath is the alarm system and the systemic dysfunction or the metabolic dysfunction underneath is the fire. So let's talk about what you can actually do about these problems. So you don't need to be diabetic to have early signs of trouble. You just need to notice the signal. So we need to do things like cut out sugar and fermentable carbohydrates. We need to prioritize nutrient-dense food such as meat, liver, eggs, seafood. We need to support the saliva by drinking things like mineral water, which will give us some of those essential electrolytes back. Chewing our food very well, and nose breathing. All of these things support and increase salivary production, saliva. We need to rebuild gut health through fasting and low toxicity eating. So we got to eat the right foods, and we have to eat in limited eating windows. And then we need to test insulin, not just A1C, and track your inflammatory markers. So there was one pilot trial in the clinical oral investigations in 2012 that found significant improvements in gum health and oral pH after just 30 days on a low-carb, anti-inflammatory diet, even without increased brushing. So not changing anybody's brushing habits. And as I've talked about in other, dental-related metabolic syndrome videos, if you cut down on the carbs, you're also getting rid of the cavity-forming bacteria as well. So you can improve your dental situation from both a cavity standpoint and a gum disease standpoint. So your body, it wants to heal. You just have to stop interrupting it. So this has been episode 72 of the Obesity Project, the hidden oral signs of metabolic syndrome. Just remember this, your mouth is a mirror, not just for your oral hygiene, but for your metabolism. Things like bleeding gums, dry tongue, recession, bone loss. It's not about laziness, and it's not about bad brushing. It's about an inflamed, overloaded system that's trying to tell you something before the lab results ever catch up. And don't forget, here on the Obesity Project, we're cutting through the myths, getting to the root. And this has been Dr. Mark Shankman. Thank you so much for watching. I hope you learned a little something about dentistry as well as metabolic disease. And I'm here to tell you we need to get this information out. I will focus for a short period of time on dental. But again, the reason I'm doing this is because I want people to realize this isn't just about, as an oral surgeon, I'm not just focused on the patient's mouth. I really want to help people on a full body level. And we need to really get a grip on insulin resistance and understand how most of the chronic disorders come from insulin resistance. And we can make a big change in people's lives. So thank you so much for watching. Like, share, and comment. Hit that subscribe button. Make sure to hit that bell notification. And thank you so much for watching. I'll see you in the next video. Take care.